Yes, we can start. Thank you for the great introduction. Namaste, all Sishyas, respected gurus, Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshal Jagat Sarvam Tasmai Sri Gurave Namah. I would like to begin my presentation with a humble prostration on the feet of all my respected gurus. I would like to express my sincere gratitude to Rashtriya Ayurveda Vidyapith for giving me such a wonderful platform for sharing my few thoughts and treatment experiences regarding Ayurvedic management of some of the eye disorders. Furthermore, I would like to extend my sincere thanks to Vaidya Devendra Trigunaji, President RAV, Vaidya Dr. Manoj Nesri, Advisor Ayush, Ministry of Health, Vaidya Anupam Srivastava, Director RIV, for their constant support and valuable guidance. It is of immense pleasure and pride to be a part of Gyan Ganga, the knowledge voyage. I welcome all of you to my session. Slides, is it visible? Yes. Respectable full pronouns to my uncle and earlier Guru RIV, Dr. NPP Nambudri. Today I am trying to explain and about some eye disorders and its Ayurvedic management. The topics which today I am going to cover: the retinitis pigmentosa, corneal dystrophy, keratoconus, glaucoma, diabetic retinopathy, macular degeneration, and the computer vision syndrome. Retinitis pigmentosa. These are all two pictures which you can see on the slide. How a retinitis pigmentosa people can, a man affected with RP, how he sees. The central vision may be clear. And at the second picture, it is very clear. The outer area, it is spreaded with the body specules and something salt pepper presentation in the outer periphery of the retina. He is seeing only through the central portion. RP, this one is a bilateral progressive vision loss happens with RP, and the signs like night blindness, and in fundus examination one can see corpuscular pigment deposits, narrowed arteries, and the patient may experience tunnel vision, and a typical kind of optic atrophy also characterized by the primary retinal degeneration. And here the dosha involved Adam and Pitta. So Vadahara Chikitsa, Rasayana Chikitsa, rejuvenation therapies are very helpful in the management of retinitis pigmentosa. In according to Ayurveda, some direct terminology it is not mentioned as such, but symptoms similarity with the sum of the Drishtigata rogas, Kapha, Pitta, Vidakta Drishtis, Naktanthyam, everything comes under this. It finally, if unattended, such cases finally leads to total blindness. The progression in retinitis pigmentosa is very slowly progression taking place in RP conditions. There are two pictures you can see on the frame, and the pigmentation, it is very less pigmented areas. The second one, little more advanced pigmentation, and the third one, it is advanced changes in the field images and end stage. Here the outer pigments as well as in the central macular area also you can see some degenerative and dipping changes. Here the RP and also there is some macular degeneration is there. RP, this one is a degenerative condition. Optic nerve degeneration and hereditary reasons are there. We can compare it with some Vidakta Drishtis, Pitta Vidaktam or Kapha Vidaktam kind of Drishtis, Naktanthyam, Divanthyam, and it shows some accommodations defect and peripheral vision problems may be noted in the early stages, even in the advanced stages also. And the reduced central vision lead to the later stage to complete blindness. Visual acuity may be normal in the center. Contrast sensitivity is affected in the early stages of stage than visual acuity. Bony specule pigmentary changes can be noted in retinitis pigmentosa. And retinal pigment epithelium atrophy associated with the anterior narrowing also can be seen in retinitis pigmentosa. Macula may be slowly affecting and getting atrophied. Epiretinal membrane. The early stages, there may not be any membrane development over the retina. In advanced stage, some kind of fluid retention taking place in the retina. That time, some epiretinal membrane develops on the retina. And the macular area drusions kind of things also we can see through one fundus fluorescent angiogram reports. Pathogenesis says the word dosha in the RP condition, the dosha vaishemya mostly take place in the fetus stage itself, and that disturb the normal function of the dhatwagni of the baby, and a degenerative process take places. It is not always due to the nidanas mentioned in the classics, Ushnahidaptasya Jalapravesha. It may not be due to that one. Sometimes it is genetically inherited problem in many of the conditions. In the first padala, Srodhorodham occurs by the Vaishamya of Tarpaka Kapha and Dhatwakti Vaigunya. Here the Alojaka Pitta and Pranavayu also involved in, and vitiating the corresponding dhadus in the last padala, and then complete dhatu dushti taking place, and ends in pigmentation, degeneration, and that degeneration, it is progressive in nature. It can be treated in 4 different stages: kapha, vishama drishti, kapha vidaktha drishti, kapha vitta vidaktha drishti, and drishti hadam. Kapha vishama drishti, here we can consider it as very early stages of retinitis pigmentosa. In the kapha vidaktha drishti, there is some utklesham taking place and the progression happening, and the progression from the sides, the cells are degenerating, and towards center the vision loss happening. In kapha pitta vidaktha drishti, even that involves to the macular area also. There the rods, the cone cells are more concentrated in the macular area. That area also getting affected in the later stage and ends in drishti nasham. In many of the retinitis pigmentosa cases, amapachanam is required in almost all the condition, not only in Drishtigata rogas or retinitis pigmentosa or macular degeneration, all the condition, Akshikuchi Bhava roga, Pradishyaya, Parnachara, Panjade, Panjaratrayana, Prasangam Yandi, Lankanath. Lankanam, it is the first treatment we should adopt in any of the begins the treatment with the Lankanam or Amapachanam, Deepanam kind of medicines are required, without which if we give some medicines for the management of RP or whatever condition, it will not affect. And again, the amatwa comes and the problem may increases. That may be the ultimate result. Shodhana Chikitsa can be adopted here. In Rasayana Chikitsa can be adopted here. Therapies can be adopted here in the management of retinitis pigmentosa. Here, Amapajanam, Snehanam, then few days of Snehavanam, we can give Virachanam, Sarvanga Apyangam. The massages, something upward massages we can adopt here. The spine massages, the Jat massages, Siro Apyangam with the Brahmana Tailas or Kritas can be adopted here in the management of retinitis pigmentosa. The Kritas like Jivandyadi Kritam, Padavaladi Kritam, Hatraifala Kritam, those things need to give us a give for Snehabana purpose. After Snehabana, after Virajana, one should give Virajana, then Samana Ushadas or Brahmana Ushadas like Chakshushya Ushadas like Drashadi Gashayam. Ashwagandha, Saptamrtaloham, Mukta Shukti Basmam. So many Ashwagandha Rasayanam, Amalagi Rasayanam. But while giving all these medicines, if with some adjuvants, if you are giving Amalagi Rasayanam, if you are giving, add Mukta Shakti in that one, that potentiate the efficacy of Amalagi Rasayanam. Ashwagandha, instead of giving simple Ashwagandha combined with the Saptamrtaloham and little Mukta Shakti with Shukti and with honey, that will be more effective. So that potentiate the efficacy of that particular drug. Saptamrtaloham and a combination of Ashwagandha, tender moringa leaves powder, spirulina, it is a good drug of choice, and Jivanti, it is a good drug of choice. Rajata Pasmam, it is one small quantity we can add in many of the combinations in the management of retinitis pigmentosa. Samana Kashayas like Drakshadi, Saptamrtaloham, Sivukodiga, already I told you, and the treatment modalities like Shirodhara or Shirobasti with a Balasugandha Thailam, Dhanundaran Thailam, etc. can be used. Tarpanam and Pudabagam. Tarpanam with the Sadahwadi Tarpanam, Jivandyadi Tarpanam, Pudabagam with the Jivaniya Siddha Pudabaga can be used in the end stage of Tarpanam. That alleviates the tiredness which is caused due to the Tarpana, the Pudabaga, ultimate effect of Pudabaga. That is as a medicine as well as that relieves the strain happened due to the Tarpana. Anyway, one should explain to the patient that the RP or retinitis pigmentosa, the treatment what we are adopting or who are adopting, this helps to maintain the quality vision or to improve the quality vision and reduce the risk of progression, because there are patients even still attending 25 years back, patients which I attended, still those patients are meeting and coming for the treatment that is giving some relaxation, because at least they are maintaining in that level. Only the proper medication and timely medication is required. At least to maintain the vision for long period of medication is required. I'm just presenting one small case study. 41-year-old female had difficulty in vision since childhood. At the age of 13, she developed floaters. She developed night blindness and loss of peripheral vision. Later on, she underwent a cataract surgery in 2011 and experienced some improvement in vision. However, vision started diminishing soon after the surgery. Unaided visual acuity, it was 636 and 612. With the glass, it was 612 and 69. And near vision N6. Visual field analysis showed profound constriction of the peripheral field with a sparing of approximately 5 degrees of central vision, field vision. These two field vision reports, March 18th, 2018, and other one it is 9th May 2021. These two reports, this shows at least it is maintaining the vision field in this 3 year period of time. So proper attention, timely food, nutritional diet, healthy diet, doing some yoga, pranayama, breathing exercises, all together work here in the proper and good management of retinitis pigmentosa. Treatment as well as a proper counseling also required whenever a patient of RP comes. Next comes the corneal keratoconus. This one is a non-inflammatory condition, but sometimes it is inflammatory also, usually bilateral. And this even CP patients are more prone to this one. Mental retardation people, they are more prone to this keratoconus condition. And they were because they were too much rubbing their eyes too much. And those who are having the inflammation in the upper eyelids or lower lids, those people are more prone to kind of keratoconus. And here it is characterized with the thinning of the corneal stroma and protrusion of the cornea. The predominant dosha here it is vata associated with the pitta, because the patient feel little too hot feeling in the eyes also. Most common cause it is constant rubbing, and the constant rubbing it may be due to even the problems of the nasal passages, deviated nasal septum, the lacrimal duct blockages, follicular spring cata, other pathologies also may be the reason for the keratoconus. Untreated astigmatism also may lead to keratoconus. There is some irregularities in the cornea happening in the case of astigmatism. Untreated and without using glasses or without attending properly, if they are seeing or utilizing their eyes for longer period of time, that lead to keratoconus. That also in different forms. The central corneal thinning happening and the protrusion taking place. Some in case pellucid marginal degeneration, that is a condition where the cornea, the outer periphery become bulging out. And in some other cases, whole cornea in the even way, it is protruding out. There the thinning may be more. In those conditions, the vision, it may be a little glary vision. In the clear keratoconus, this is the typical presentation of the keratoconus. The cornea, it is protruding out. Here also, we can see specifically some conical shape in the cornea. Munson syndrome. And progressive decrease in vision happening in the condition of keratoconus and recurrent changes in the number. Axis always changing, 180-degree axis or sometimes 10-degree axis. It's always changing in keratoconus condition. Hydrops, sudden onset of pain and redness or tearing and a blurring of vision. It is a very serious condition, hydrops in a keratoconus condition. Those happening, some people in keratoconus, the line of management in many conditions, it is contact lenses. Continuous usages of contact lenses. That leads to erosion on the cornea, or sometimes even without contact lenses, rubbing with the hands or some foreign body going on the conical cornea. So inflammation taking place. And particularly some white corneal opacities are taking place on the cornea. That leads to ultimate severe pain. And the limbus margin, the cornea, sclerocorneal margin also, some lot of color differences taking place, even ultimately leads to intraocular pressure raise. That condition is planning to explain later on. That condition is glaucoma. If something happens, maybe before developing the hydrops, the vision may be good. Once after developing the hydrops, the pressure increasing and that pressure later on damaging the optic nerve and the vision loss happening. Signs of keratoconus are central corneal ectasia with the thinning, irregular corneal reflex, Burger's trier, that means parallel tension line in the stroma, and Flesher ring, it is iron line outlining protruding cone, and Munson sign that we shown to you earlier. Eye drops, as I told you, it is acute breakage of Descent membrane causing edema and a corneal opacity that leads to corneal opacification. Weger's strier, this kind of a presentation on the cornea, and Flesher ring, you can see kind of discoloration changes on the corneal surface, iris area, and this one is the hydrops and much inflamed stage, and the limbus margin also it is edematous. Probably in this condition, you can see the margins of the lids, it is thickened. This thickness ultimately there are some small pustules like things we can see here. These two. This gives some erosion to the cornea and leads to it is a much painful condition. And the aim of the treatment in the keratoconus it is to maintain the vision status, reduction dryness, reduce vision loss from irregular astigmatism and myopia, and reduce chances of eye drops and reduce corneal scarring and minimize change of progression of corneal ecstasias. Here the treatment include Vadaja Timira Chikitsa. Chikitsa includes Snehavanam because dryness happening, Snektada need to get. So Snehavanam it is very essential. Here we can give the Snekavana with the Padavaladi Kritam, one good drug of choice. Mahatraifala Kritam, we can give Saptamada Kritam can be given, or Gulgulu Dikdaka Kritam, even high drops are there, and corneal ulceration is there. In those conditions, Gulgulu Dikdaka Kritam also can be used. And Pandu, in the drug mentioned in the Pandu Chikitsa, the Dadimadi Kritam is effective in this condition. Here, Pandu Chikitsa also some extent effective in this condition. And always use some lubricant medications. Don't make that eye very much dry. So getting lubrication, one can use the drops made out of, or it is processed with alum water can be used. That frequently they can apply. And if some lid edema or kind of issues are there, we can do some hot fermentation if it is not creating any irritation. Follicular changes may be there in the lid margins. We should erase, that is, or break. Otherwise, further erosion will take place. Even averting the lids and doing lekhanam also very much effective in some conditions. Because cornea it is affected, but why we are doing lekhanam? So the thickened portion of the inner of the lids that gives erosion on the cornea, that repeated erosion leads to more thinning of the cornea and high drops or corneal opacification kind of problems. So one problem leads to a second level of problem if untreated. And here we can do nasyam with Anudayila nasyam in the form of Pratimarsha nasyam or Vasalas Marsha nasyam. And doing Marsha nasyam, after nasyam, one should do Kabalam with the Trifala Kashayam, Trifala and Trifudu Kashayam, and application of little castor oil or pure cow ghee which is made in home. That also can apply externally over the eyes to overcome the dryness. The protrusion taking place in the keratoconus, so the protrusion thing, it should go inside. So we can't do too much of pressure on that cornea. We should give some minimum soft pressure. So we can do bandhanam with little pushpams, like Malati pushpam can be used. Malati pushpam, then tender betel leaves, and Nandiarvatam flowers, Jadi hibiscus flower also can be used externally. So all the time it is mentioned, the classics mentions Malati pushpam, it is mentioned. It is not just Malati pushpam. Hibiscus flower, it is very effective. Even to control the eye pressure also, it seems very effective, the swarasam of hibiscus flower. And it is too much hibiscus, but no irritation with the hibiscus flower dipping within the eyes. The kashayas and medications which we can use in the condition of keratoconus are Netraraksha Kashayam, Bulichadi Kashayam, Saptamridam Kashayam, Rajanyadi Churnam can be used, Rajanyadi Churnam, Haridrakhandam to subside the allergy, Saptamridaloka Masaya, Rasayanam, Mridvigarishtam, Lohasom, Rasharishtam, same. Pandukara measure also can be adopted here. And Vidaryadi Kirtamase, Brahmana Aushada, we can do here. Saptamrita Kritam, Trifala Kritam, we can use it for Tarpanam as well as oral purpose also we can use. Already I told you. Again, Snehabanam with the Saptamrita Kritam, Kashyapakritam, Virajanami Tavyuti Churnam, mixed with the Padavala Muladi Kashayam, Gandharvastadi Kashayam, Nasameta, Anugailam, Shatpindu Dailam, or Varanadi Shira Kritam, Nasyam. Here the Pancha therapies like, that is Kriyakalpas like Netradhara with HT Lothra Kashayam, Trifala Kashaya Shalam. These are all lubricating effect and cleanses the eyes. Lothra HT, if the opacification is there on the cornea, that also subsides with the usage of your Lothra HT Kashayam. Astrodanam with Padoladi Krudam, Anjana Krudam, that gives some lubricating effect and heals the vrinam on the cornea. Patching with the betel leaves, as I told you earlier. Anjanas like Jadi Muladi Anjanam or Chandanadi Varti Anjanam. All these Anjanas we can use, but make sure don't irritate the eyes, because if possible, make it a clear drops and then apply, it will be more effective. So there are some new techniques are available just to make it buffer inducing and making it in a clear liquid. That way, providing it is more effective, because that won't irritate the eyes and it won't limit the qualities of particular anjanas, many of the anjanas. And Tarpana can be used. But many, all the condition of the keratoconus Tarpana is not advisable. In the high drops condition, we are not supposed to use any Tarpana. In the early stages, in the progressing stage, we can do Tarpana with Kridas, Purana Kridas, Tripila Kridas, Shadakwadi Krida, etc. External therapies like Sirolevam, Talam, Shirodhara, because continuous by in keratoconus Shirodhara, that gives snigdhata. And also the nerves are getting strength here. Because of the continuous strain on the eyes, nerves are getting weaker. So that weakness again lead to further complications in the, not in the Krishnagada, in the Drishtigada. That should not happen. So one should adopt dharas, shirolevas. So what all the therapies, procedures which is effective and strengthen the posterior segment eyes, that we can adopt. Not only the therapies, the good food, diet habit, everything. And this is one corneal topography picture, corneal mapping. There is 3 picture of one particular patient with 3 different dates: 23 May 2020, 8th December 2020, and 22 October 2021. This is the first, the corneal bulge, it was more, that came to little less in the next time and almost maintaining in the third time. So we can control it, we can reduce it, but may not be possible to make it 100%. So in rare cases, it is possible also. That depends. In the early attention, in the early pinning changes, if you do Tarpana or Bandhana kind of procedures, it is very well manageable, and we can make even 90 to 100% vision back also. Other one particular condition, it is corneal dystrophy. Corneal dystrophies are a group of rare genetic disorders that affect the cornea. This is also a hereditarily happening one problem. If parents are affected, siblings also getting chances to get affected. So even yesterday also one patient came with a corneal dystrophy. Only 2 weeks back only the patient came to know that there is some corneal issues. They consulted elsewhere, suggested for cornea transplant. But now the child can see things. So I suggested not to go for the cornea transplant. Here, this is the particular presentation of corneal dystrophies. Some small white spots are developing on the cornea. It is a degenerative spot. It starts with one spot or two spot, and later on it is increasing. Here in this condition, cloudy vision, sometimes acute watering, acute photophobia, eye dryness, glary vision, sensitivity to light, acute eye pain, foreign body sensation, and corneal erosion taking place. Mostly the pain happening due to corneal erosion because it is hereditary inheriting one problem. By it means not only happening in, it is not unilaterally, it is bilaterally happening. Case studies. This is 66-year-old female patient came here with a corneal dystrophy, corneal opacification, cloudy vision, and with a lot of eye pain. And she is using the drops like some lubricant drops as well as some other drops also she was using. When steroids also used for quite longer period of time. She find difficulty in depth perception and identifying the nearby things. Hello? Difficulty in depth perception, frequent sinus infection followed by increased blurring of vision. On examination, the corneal dystrophy detected in both eyes. Visual acuity at the time of admission, it was 1/60 and 4/60, left and right. And after a few days of treatment, that came to become 260 and 6/60. So little improvement in the vision, but other symptoms considerably reduced. And she is not worried about the vision. She is much worried about the other symptoms like pain, watering, photophobia kind of issues. Vadahara line of treatment can be adopted here. The treatments, medicines like I+, the Aruharitra Kashayadhara, Anjanam with the Naligaranjanam, Nasyam, Saptamurthalam orally giving, Tailadhara given, and Talabodachil with the Trifela, HD Churnam with and other. This one is the OCT anterior segment OCT of that particular patient. The day when she came to the hospital, that is 24th January 2021, the corneal edema and some opacifications were there. And in that anterior view, you can see the bulge on the cornea. This is the right eye. This is left eye. And after few days of medications, the edema got subsided. So she is free from her symptoms. But here this area further it is pigmented. The pigment, it is not gone completely. So need medications. So continuous medications helps further improvement in the vision. And if untreated, this 1 point going to become 2, 3 kind of dots. So ultimately vision loss also taking place. If continuous vision, pain persisting, the patient's eye pressure also tend to increase. If that eye pressure increases, vision loss. Next comes glaucoma. Next one, it is glaucoma. Everyone may be knowing about the glaucoma. Everyone may think that it is a condition, just increase of the eye pressure. So glaucoma, it is not just increase of the eye pressure. Increased eye pressure, it is just one condition that contributes here. So there may be some physiological changes in the optic disc. So that lead to the peripheral supply, it is blocking. The enough nutrients to the peripheral side, it is blocking. So with that, the peripheral vision gradually deteriorating. Even in the RP also, the peripheral vision deterioration. But in the glaucoma, there may not be any pigments, but the vision loss may be there, will be there. We can see the two picture. This is a normal picture. and one glaucoma affected patient. The central, the full picture, you can see this is the normal and this is the other one. So glaucoma, it is like this progression, it is like that. And it is a silent loser of vision. People may not be able to find it out in early stages, especially in open angle glaucoma. There are two glaucomas that I will be coming later. So this is the normal vision and slightly affected vision. Even this time also patient may not be realizing the issue, but this condition, even further vision loss happening. That time the patient is realizing further vision loss happening. If it comes down like this, the complete loss of vision happens in a short span of time. So our aim in a glaucoma, the glaucoma, it is treatable, control the pressure, control the further vision damages, that to check and stop the further damages in the vision. So what all the care and treatment need to do in this condition, we should do and adopt, we should adopt those procedures. What is glaucoma? It is a condition of increased IOP in turn causes damages to the optic nerve and leads to permanent vision loss. Normal eye pressure, it is 15 or 20 milli to 20 mm of mercury. And this is the normal healthy optic nerve. And this is the optic nerve of a patient with a glaucoma. Here the paleness and the inner ring, it is bigger. And the vein emerging, it is from outer side. And the outer area, it is not like the other, the new one, the healthy one. There is a lot of changes happening in the eyes. The circulation, the nutrition, it is lacking to the outer area. The pressure, intraocular pressure, that damages the optic nerve head. That is towards this side, the pressure exerting, that it is pushing here. It is pushing here. The same way it is gives some pressure to the anterior, the front portion also. Clinically, glaucoma, it is of two types: open angle glaucoma, closed angle glaucoma. And this condition, it is of closed angle glaucoma. There may be high intraocular pressure. Closed angle glaucoma, the steady and the slow progression of eye pressure, that is one condition. And another condition, it is acute angle closure, and with that sudden increase of the pressure and a sudden vision loss with a sudden acute severe pain that is happening. Intraocular pressure may be high, lacrimation may be there in the glaucoma, redness of the eyes, fatigue of the organs of the vision, the appearance of a bright rainbow rim around any light sources and other objects, pain in the eyes and other eyebrows, head pain and blurred vision are the symptoms of glaucoma. This can be compared with Adimantam, Vadadimantam. Abhishantam, it is an early stages. In the Abhishantam stage itself, one if we treat it, it's never going to become Adimanda stage. Common line of approach, and in open angle and in closed angle, the approach it is different. In open angle, the treatment includes rasayana chikitsa, drishti prasadaka aushadas, drishti prasadaka chikitsa. If pain or watering, the treatment to subside the Vedana can adopt here. The treatment medicines like Maharasnadi Kashaya is good in the management of open angle glaucoma. Gulgulu Tiktagam Krudam, Pathyakshadatri Kashayam, Snehavanam with Trifalakrudam, Mahatrifalakrudam. even Jeevan Jyadikritam can be adopted here. Here the treatment, it is pressure control as well as the strengthening the nervous system. That should be our aim. So Nasyam can be, the Brahmana Nasyas can be first Srodhana Nasyam, then later on Brahmana Nasyam can be given. Shirodhara or Shirobasti kind of treatment we can adopt here with Balashugandha Thailam or Shirabala Thailam kind of medicines. Tarpanam. Not all of the cases it is not applicable, but in a glaucoma condition, before starting the Snehapana or Aushadas, one should start Dibana Aushadas, Dibana Bhajana Aushadas. Without Dibana Bhajana, one should not give this Rasayanas or Samana, that is Drishti Prasadana Aushadas. In the closed angle glaucoma, the line of treatment is a little different. Our aim, the pressure to come down, restore the vision. If it is acute open angle, the acuteness, maybe it is an inflammatory pathology. So angle closed, we can't make it all of a sudden clear. So what the pressure increased, we can control with the medications. In this condition, we can do Virejanam, Nasya Prayogas, and then Nasyam with some Sorasas of Drona Pushpi Sorasam Nasyam, it is good to bring down the eye pressure. Punarnava Sorasam, it is good to bring down the eye pressure. And labas around the eyes, it is good to control the pain and eye pressure. There are labas like Sirastoda Gudigalepam or Kartavatu Gudigalepam, Mukadi Lepam, Vikshumuladi kind of Purambada, etc. can be used. And the Dhara like Takradhara is advisable. Jaladhara is advisable on the head. Kashaya Dharas can be given. The Kashaya Dhara with Usta Amalaki Kashayam or just only with Amalaki Kashayam. In Gulkulitiktakam plain Kashayam can be given. That is as a Dhara we can use. So everything, it should be relaxing and Vedana Stavaga. If that pain, other symptoms subsides, normally the pressure also comes down. The patient can maintain or regain the vision. In acute condition, what happened if immediately, if we take care, it is regainable also. If it is for a long after attending that particular condition, it may not be possible to rectify. Common line of approaches are Sohagarajikalsa, Srodho Shodaka approach. Srodho Shodaka Nasyas can be given. Kabala Gandusha, Kabala with Bulachari Kashayam with a little Gomutra, Kabala can be given. Mukhalevana and Shiroleva with Trifala ST, Vetituli kind of medicines can be given. Talam with an Imbamurdadi with Rasnadi to bring down the pressure. Takrathara or Jaluga in an acute angle closure. Jaluga and Siraveda is very helpful in the management. And in the medicines like Snahabana with Trifala, as I told you, Virajana with Abhivati Jurnam or Podolam Mulari Kashayam, Nasya with Shadbindu Thailam, Murda Thailam with Gulkulu Diktagailam, Vasti, Manjistadi, Mathyushtiadi Vasti, Matra Vasti is good. Unadvanced in the open angle as a rejuvenation, Rasayana therapies, Chachusha Rasayanas can be used. Amalagi Rasayanam, Chavanaprasha Rasayanam, everything it is good in the management of open angle glaucoma to safeguard the eyes, to preserve the vision. So in a glaucoma condition, always more important to bring down the pressure, subside the symptoms, safeguard the vision. Treatments like Swedalotra fried in ghee kirisagam. It is Srivasadi Avagundana mentioned in the classics. It is good in the management of immediate onset condition. It is good. Ashtodanamitu Shiguru Patraswarasam to bring down the pressure. Pindi with the Mukadi Karatavat, already told you, Shirodhara or Sakadhara, depending on the IOP status. Nasyamit, Anudailam, internal medicines like Vanardavadi Kashayam, Varanadi Kashayam, Pathyashadatriadi Kashayam, Desamulahari Regulation, Sudarshanam tablet, Chandra Prabhavati, Padoladi Krudam, Taifalagadam, etc. can be used. Next comes diabetic retinopathy. It is a common threat for the people in India, because many are affected diabetic, and those who affected with the diabetes in 10-year or 15-year period of time, almost all are getting early signs and symptoms of diabetic retinopathy. The early signs, little blurry vision, and that little blurry vision and little changes in the retina, that leads to problems in the anterior aspect. Even early development also, cataract also may develop with the diabetic retinopathy. So here the primary approach here is good sugar control, maintain the A1C in its normal level. Diabetic retinopathy, it is a retinal vascular complication of diabetes mellitus, leading cause of blindness, and more common type is common in type 1 than type 2. And modifiable risk factors for diabetic retinopathy can be controlled. That means if someone control the blood sugar, possible to control the diabetic retinopathy risk factor, blood sugar control, blood lipids control, body mass index maintain, over smoking or chain smoking, etc. reasons that increases the risk of diabetic retinopathy. Investigations like dilate fundus examination, fluorescent angiography, optical coherent tomography are the tests we can adopt here for the proper diagnosis of diabetic retinopathy. Classification based on ETDRS, diabetic retinopathy, it is a 4 type. Non-proliferative diabetic retinopathy, we can take it as a background changes. Here the involved dosha, here it is kapha dosha. Kapha varana taking place. There the microaneurysms, some small dot blood hemorrhages taking place, dot of exudates are taking place, cotton wool spots on the retina, venous abnormalities and intraretinal microvascular anomalies also can be seen in the early non-proliferative diabetic retinopathy condition. If treating in this stage, it is never going to become the next level. And next one, it is diabetic maculopathy. Retinopathy at the macular level. So some fluid retention taking place in the macular area. That is the most sensitive vision getting area. If that happens, probably the patient says, I can't see things. Images are distorted. So here also the main treatment is diabetic control. If it is uncontrolled diabetic for quite longer period of time, only leading to kind of this issue. It is a vision threatening edema, and ischemic changes also may be there. Next comes the proliferative diabetic retinopathy. It is another stage, neovascularization taking place, and retinal hemorrhages are taking place. This we can compare it with the urdhvagaratpatta. Here the treatment line also, it is raktapittahara chikitsa can be adopted. So taking rest, pittashamaka aushadas, drakshadi kashayam, the medicines I will be coming later. Next comes the advanced diabetic diseases. In the diabetic retinopathy, untreated, all this condition leads to, even the treated cases also, many are going to become like this. The retinal detachment happening, posterior vitreous hemorrhage is taking place, neovascular glaucoma, retinal detachment means retinitis apart from the underlying choroid level. So if it is like that, there won't be any vision. The images, the impulses which is reaching on the anterior segment, it is not reaching to the nerve layer. So vision won't be there. Posterior vitreous hemorrhages. Behind the retina also hemorrhages taking place. The traction in the retina taking place. Neovascular glaucoma. Extra blood vessels developing, and due to overfilled with blood filled posterior chamber leads to glaucoma. So it will be a painful condition. In this case, almost the vision loss may happen. And these are all two pictures. This one it is normal picture how a normal man sees, and the second one it is a patient with the second type of diabetic retinopathy, not in the early stage. The little diabetic maculopathy condition or proliferative diabetic retinopathy condition, how the patient, how he can see like this different dark dots they can see in their vision field. So looking onto the object, some areas missing, some areas getting, but in later period that area also covering. That is what happening. Spots or dark strings floating in the vision field, blurred vision, fluctuating vision, dark or empty areas in your vision areas. Objectives and steps of treatments prevents the condition from progression to the next level. Untreated leads to vision loss. Prameha hara chikitsa treatment for pradhana vyadhi, that is always there is importance. Without treating prameha, there is no treatment for prameha janya netra rogas. So first treatment for the prameha, that to control. If that is coming control for longer period of time, and a healthy diet, healthy physique, everything will be helpful. Kapha pradhana tridoshakara chikitsa also can be adopted here. Kapha pradhana tridoshakara chikitsa. Here the first kapha avarana it is taking place is the first. The kapha avaranatam of kapha need to treat first. Then tridoshakara chikitsa, that is, and along with the chakshusha chikitsa is put in the management of diabetic retinopathy. Abhishandahara and Kledavhara chikitsa also can be adopted here. Deepana Pajana always visible in almost all the diseases. And good pathya, dietary regimens. So those who follow the diet which never increases Srodharodham, Amatvam, and sugar increasing kind of medicines not supposed to use. So allergy creating drugs or aushadas or aharas also cannot be used. And this is the non-proliferative diabetic retinopathy picture. Characteristic features are hemorrhages. These are all some small hemorrhages. Exudates are present here, and these are all exudates. These exudates and microaneurysms. There is main vessels, and from that some new blood vessels are developing, and the new blood vessels only going to break and hemorrhages taking place. In the objectives of the treatment includes pramehara chikitsa, kapha medohara chikitsa, and sthanika chikitsa to stabilize blood vessels. Netra kriyakalpas like Ashtodanam, Netradhara, Anjana, Tarpana, Amapachana, everything can be done here in the management of diabetic retinopathy. Swarasas like Sahadevi Sarasam, Ashtodanam, Durva Sarasam with honey, it is a good thing to, if there is some hemorrhages or clots are there, to alleviate the clots inside, it is good to control. Netradhara with the Trifala Ishtimadu Kashayam, that also breaks that clot which is there, and Lothra Kashayam, that is helpful in and early reabsorption of the clot from the eyes. And in that Lothra Kashayam, just make a potali, take little laksha and make a small potali and keep it in that Kashayam. Laksha, it is a good Rakta Stambhaga Aushadha. Anjanas like Jadi Mukuladi Anjanam, Chandanadi Anjanam. Tarpana, it is optional. In all the condition, we can't do Tarpana. In a proliferative condition, we are not supposed to do any Tarpana treatment. In a total detachment condition, Amatvam, if it is there, we are not supposed to do any Tarpana. Tarpana, it is adopted in the first stage, it is adoptable. In a advanced stage, total detachment as a rejuvenative for the optic nerve in the future stages may be possible to adopt. But Tarpana, it is a very commonly it is not practicing. Another comes diabetic macular edema. It is a common cause of visual impairment, especially in type 2 diabetes. Diffuse and focal changes are taking place. Diffuse, extensive capillary breakages taking place, and focal leakage from the microaneurysms and dilated capillary segments associated with exudates. Further accumulation leads to cystoid macular edema. The treatment line includes Kapha Pitta Shamaka Chikitsa, includes Kashayams like Varanadi Kashayam, Punarnavadi Kashayam can be given, and Samira Vanjayam Kashayam can be given, Amapachanam, Hinguvachadi, you can give us an Amapachana drug, Shodohara Chikitsa. Chandraprabha is a good diuretic and Shodohara Aushadha can be given, Trifala Gulguli can be given. Taktavha Srodohara Chikitsa. Manjishtadi Kashayam with Kaishora Gulgulu. Mahamanjishtadi Kashayam with Kaishora Gulgulu. Or Mahamanjishtadi Kashayam as such you can give as a diabetic in the management of diabetic macular edema. Guluchiadi Kashayam can be given as a Chachushi Aushada. Sonita Amradam Kashayam available in Yogaratnagaram, Samira Vanjayam Kashayam, Guluchiadi Kashayam, Sahasra, it is mentioned in Sahasra Yogam, Lakhu Vashadi Kashayam, Mahavashadi Kashayam, Bilwadi Guliga, Mahamanjishtadi Godam, Trifala Gulu, Chandra Prabha Guliga, Kumari Sarasam. Even in the bleeding condition, if you add little lemon in it or little amla juice in it, it is more effective because vitamin C supplement is required. And Kadali Gandham, Tulasi, Haridra Swarsam for reducing Srodoroda and a fat deposit reduction. Sudarshana tablet also can be given. Other therapies, Nidalaga with Sakadevi, Tulasi Swarasa with honey, and Sakadevi with Haridagi Jurna mixed with air and item. Pindi with Alambusha. Alambusha means in Malayalam we say it as Mukuti and Manduga Vardi. Anjanas with Jadi Muguladi, Chandanadi. There are so many Anjanas preparing here because if I say also won't be able to understand. So other thing, Aschodana with the Durvakradam, Padoladi Kradam. In this condition, Durvakradam, Padoladi Kradam, you can add little small bee honey also along with that Durvakradam or Padoladi Kradam will be more effective. And that increases the efficacy of that and Durvakradam or Padoladi Kradam, and it is more healing also. Even in a wound condition, we used to give Jatyadi Kradam with honey application. That gives some immediate result than just simply applying Jatyadi Kradam. Other therapies like Avipatti Jurnam mixed with the Padolam Muladi Kashayam, Virajanam can be given. Basti with Guluchadi Kashayam with Gomutra Basti, Punandavadi Kashayam with Gomutra Basti, Lakhu Vashadi Kashayam with Gomutra Basti. And these Bastis we are doing, it is not with any Kalkas or other Sneha Ushadas. Just with the Kashayam and Gomutram we are doing. External therapies like Sirovalebam, Talam, Siroveshnam or Talapodichil can be given. The Siroveshnam with Vasa Jurnam, Laksha, ST, Amalagi Jurnam, that we can mix with the Vasa Gulachadi Kashayam can be given. Takrathara with Mustamalagi, Laksha Kashayam, Vasa Gulachadi Kashayam is effective in the management of macular edema. This is two pictures, one before treatment and after treatment, macular edema. Next comes proliferative diabetic retinopathy. Here the neovascularization taking place. Neovascularization taking place. You can see in this picture, this white structure changes, it is due to the detachment of the structural detachment changes, and there is some hemorrhages are there. And the second one shows there is some extra blood vessels are developing. Here also in the cut section view, you can see little bulge or bulky disc margins. This secondly developed vessels, it may break and that lead to ultimate bleeding. And here the neovascularization developed in the iris margins also. You can see the iris Around there are also some extra blood vessels are developed that lead to even we can see the outer sclera and the cornea. It is more close to the inner of the cornea, this iris. So here the angle it is closed. So it is so far somewhat atrophied. And inside, in some condition, we can see the thickened blood vessels. This also may break. In proliferative diabetic retinopathy, the line of management is similar to that of orthogaraktabita. Principles of Vata Rakta Chikitsa, Jwara Chikitsa or Panda Chikitsa also can adopt here. Next come retinal artery occlusion. And it is not so common, but a lot of cases are coming here. Retinal artery occlusion. Here the main retinal artery occluding and this entire retina it is undersupplied, hypoxia and no blood flow taking place. So in this retinal artery occlusion, if it is a central artery occlusion, the loss of vision it is gross vision. And you may not be able to find out any more features on the within the eyes and those kind of people. The detailed cardiac evaluation or carotid artery evaluation is required. Whether there is any Srodha is there or not. Level of lipid to find it out. If the lipid level is high, the treat accordingly. Some enzymes, increase the level of some enzymes, if it is like that. So to improve that condition, what therapy is adopted, possible in Ayurveda that we should adopt? Two main types are found the artery occlusion. One is central retinal artery occlusion, other one it is branch retinal artery occlusion. Central retinal artery occlusion, sudden painless loss of vision, signs like cherry red spot in the central part of the macula, kind of this. Retina is seen milky white, kind of milky white, or otherwise it is little pinkish appearance. Retinal arteries are narrower, arteries becoming very narrower, and direct pupillary eye reflex is absent, and cattle track appearance and diminished and interrupted blood flow like cattle track we can observe. And this especially this CRAO found in many of the post-COVID, many of the people got this CRAO problem. And there may be some retrobulbar issues also could be the reason for the arterial occlusion. Even the lesion in the posterior segment could be the reason for the arterial occlusion. So everything need to trace it out. Anything lesion obstructing or any pumping defect or any arterial occlusion or carotid artery, anything problems are there or not, find it out. And this one is a picture of branch retinal vein artery occlusion and present as an acute onset of painless monoocular visual impairment. Mainly the central vision may not be affecting that much. VRAO often occurs with a more focal loss of vision since it is only affects the branch of the retinal artery. If affected area is not in the center of the eye or is relatively small, a BRAO may be unnoticed and only in the later period while checking through one fundus fluorescent angiography or OCT only able to find it out there is problem. Ayurvedic management, like in arterial occlusion, all the Hridya Aushadas can be used. The Kashayas like Nayobayam Kashayam, that upward massages, carotid upward massages, spine massages, Shiro Apyangam, Shiro Martanam, Shirodharas, and the Chachushi Aushadas. And the Kashayas, which even Dasnadi Kashayam, add little Dhanundaram Avarti in it, or Chirabala Avarti in it. Or in Kashayam, we can add little Padavaladi Hridam or Vidaryadi Hridam kind of drugs. It will be helpful to strengthen the arteries and to improve the circulation. So, circulation to improve and first of all, trace out the exact reason. Arterial occlusion with the different occlusion also taking place in different places. Oh, here Astodhana with the Moringa Swarsam. തളം വിത്ത് കച്ചോരാതി ക്ഷീരബല, തലപൊതിച്ചിൽ വിത്ത് കച്ചോരാതി യൂർണം നിംബാമുദാതി ഏരണ്ട തൈലം, ബലാശുവന്ത തൈലം, ശിരോഅഭ്യംഗം വിത്ത് ശിരോഅഭ്യംഗം. Not only in Shiras area, nape of neck we can do the massage. That everything in upward direction we used to do. And the temporal area towards sides, that massage also helpful to improve the circulation. So what all the measures we can do to improve the circulation, that is the only aim here. Improve the circulation, improve the blood level, and improve the vitality. So Rasayana as a stimulation therapies will be helpful in the management of CRAO or PRAO. Nasyam, it is a good line of management. Brahmana Nasyas can be given. Depends the condition. If the Lankana needed, so we should do Lankana. That only by assessing the patient only we are able to see. Tarpana treatment is applicable here. Hridya Aushadas, Pranayama, breathing exercises. Some specific asanas can be adopted here. Next comes retinal vein occlusion. This one is a picture of retinal vein occlusion. Vein occlusion, it is of mainly two types: central retinal vein occlusion and branch retinal vein occlusion. It is caused due to thrombosis or embolism, common in elderly individuals with pre-existing conditions like hypertension, arteriosclerosis. Hypertension, mostly it is a common reason for the ischemic central retinal vein occlusion. Even diabetes also a reason. So diabetic control or hypertension control, it is one thing need to do immediately. Then Sodoharachikalsa also can adopt here in the management of central retinal. It is easily manageable condition. CRVO, it is an easily manageable condition if the proper medication, timely medication if we provide, but in a delayed stage, regaining chances are less. So in acute stage treating, it is easier, and only here the necessity of the treatment to bring down the acuteness. The later stage in a chronic condition, here the circulation totally losing, and even the arterial occlusion also, arterial occlusion as well as the venous occlusion, arterial nerve conductivity also losing in the ischemic CRVO condition. So in non-ischemic, ischemic and non-ischemic. Non-ischemic condition, there may not be much occlusion, that papilledema, everything we won't be able to see. But you can see in this picture, some of these pictures, it is similar to that of early stages of diabetic retinopathy or hypertensive retinopathy. Here the tension increasing and the occlusion taking place. Only minimal occlusion it is there. So in a lazy condition, the patient find blurry vision. When circulation improves, that means in a waking up time, there may be little less vision. But when start walks, the vision acuity slowly improves. Towards evening, it is okay. Whenever he sleeps or resting, that time vision coming down. It is of mild blurring condition. So this also can be treated. Next come ischemic vein occlusion, sudden, serious, painless, marked or total loss of vision. Anterior segment neovascularization and leading to neovascular glaucoma is the major complication. Tomato splash appearances are there in central vein occlusion, and cotton wool spots we can see here in the ischemic occlusion. Retinal hemorrhages are there, soft exudates and papilledema. This is papilledema here. And macula hemorrhages and macula hemorrhages changes and edema may be there in the macular area, and that case to case that differs. This one is one picture, and earlier show you another picture. There is two different kind of presentation. Afferent pupillary defect also may be there in ischemic vein occlusion. In branch retinal vein occlusion, there is some partial vision loss only taking place. Blockage of one or more branches of the central retinal vein. More branches of the central retinal vein taking place. Here the peripheral vision was taking place. Blurred or distorted central vision, floaters, too much floaters. VRO is a common in patients with high blood pressure, diabetes, and atherosclerosis. These are all the different stages of BRVO. I'm not And the last one you can see, if untreated, that the intense cloudy white signal indicates leakage of the fluid from the affected retinal vein. So if it is in the outer area, if untreated, if that from the earlier onset area, it is the exudates coming down to the macular area and thereby losing the vision. Ayurvedic management like Pindi Vidalagam with Durvasaka Devi, Drona Pushpi, Mukuti, Kumari can be given. Mukadi Purambada, Ishumuladi Purambada, everything it is good. Kashayam with Manchestadi Kashayam with Trifalagul Guru, Ishti Kashayam. Manchestadi Kashayam orally can be given, and Manchestadi close day Segam also can be given. Ishti Kashayam Segam can be given. Lodhra Kashayam, Lebam with Vasa Lasha, Ishti Lodhra, Amalaki Kumari, Chandana. Ashodan with Sagadevi, Tulasi Hani, Talapotichil with the Vasa, Laksha, Eshti, Lothra, Malaki, Musta, Takahara also can be adopted here. Next comes macular degeneration. What is macula? It's the part of the retina responsible for the straight head central vision and responsible for the focusing central vision in eye. It controls our ability to read, recognize faces or colors, drive a car and see the objects in fine details. Any diseases that affects the macula will cause impairment in the central vision. So if little problem happens in the macula also, the patient feels. But little problem happens in the outer periphery, the patient won't feel. That is the difference. Maybe the problem extent may be more in the RP, but may not be able to recognize. But little problem in the macular area, it is easily can feel. The patient can feel easily. This is a normal picture of the macula. That is the most sensitive part of the retina. And the cone cells are more located in that area. Normal retina. Degeneration. A process by which a tissue deteriorates, loses functional activity, and may become converted into or replaced by other kinds of tissues. The normalcy losing macular area, the images are falling in that area in a different way, in a distorted way. It is impulses reaching to the brain. And macular degeneration is seen in both adults and the children. And genetically also this happening. Same like RP, macular degeneration also hereditary onset is if the parents' consanguinity is decreased and the climatic changes in many places, the people are getting macular degeneration. Those who are looking onto the eclipse for longer time, those are getting macular degeneration. And those who are exposing to the welding light for longer hours and nowadays in a computer screen for quite longer period of time without shifting the eyes from that screen, those people are getting macular degeneration. Who is getting, we can't give a specific definition. Many are getting. And several inherited and rare diseases that affect children and young adults. They include Stargardt's disease, West disease, and juvenile retinoschisis. And this Stargardt's disease, you can see the first picture. Here, the central area, the cells decayed and they become like a bullseye appearance. The central area it is, and one area it is bigger and other area it is degenerating. From the small area this is totally damaged and other area it is going to become damaged. And the other one it is Best disease. Here also some white presentation developing on the retina in different places. And other thing it is juvenile retinoschisis. It is a dry degeneration. It is not fluid here. If this consistency loses, that also lead to vision losses. So if this loses, the vision loss taking place and can't be able to see clearly. Another one, next one, age-related macular degeneration. And this one is the third leading cause of blindness globally. Global prevalence is of about 170 million. Age-related macular degeneration is the leading cause of irreversible blindness in the adults over 50 years of old. Prevalence increases with age and symptoms are rare in patients under 50 years of age. And there are more risk factors in this condition. It is modifiable risk factors and non-modifiable risk factors. Non-modifiable are age. We can't control it. Sex, females are more prone to this problem than male. And iris color, the bluish color iris, those people are more prone to this MD. And the genetic constitution, it is one another reason. And pigmentation, mainly whites are more prone to, and ethnicity. These are all the non-modifiable risk factors. And the modifiables are smoking, sunlight exposure, obesity, cardiovascular diseases, undernutrition or malnutrition. These are all the risk factors. So if the risk factors, these things one can control and other thing nobody can control. How does a patient present with the macular degeneration? This one is an arm's length. You can see the first one, it is a normal picture, and the second one, it is baby distorted picture. Straight lines appears baby and blurry vision. So looking onto the face of or looking onto some major images, the focusing area can't be seen and other areas can be seen. Only to tilt the eyes, then only able to see the picture. Here the distortion taking place. Objects may be appear as a wrong shape or size. A dark empty area in the center of the vision also may be there in a case of MD. Even if you read and the focusing point not getting, only with some convex lenses they can manage bit. Classification of ARMD, it is early stage and late stage, exudative and non-exudative stage. Early stage, it is manageable. Late stage, it is not manageable. If early stage, unattended, going to become advanced stage. Exudative stage, nowadays, there are injections, steroid injections, many things are there. Even with that also, it is controlling and relapsing. So with our Samana Aushadas and Srodha Shuddhikara Aushadas, some extent we can manage without progressing it again and again and again. Srodhohara Aushadas. Punarnava, it is a good drug of choice. Punarnava Gulgulu is a good drug of choice in exudative condition. And Punarnava, Chandrapa, everything has got a pure good diuretic activity. This diuretically acting medicines that give some good relief and relaxation in the macular area. Dry ARMD symptoms comprising 90% of the diagnosed cases are ARMD dry, and it is a gradual impairment of vision over months or years. Both eye are usually affected, often asymmetrically, symmetrically also affecting. Drusions also seeing extracellular deposits seeing in the retina. Macular thinning taking place. There's also different kind of presentations. Some are it is sudden progressing, some are it is slow progressing. You can see some 3-4 pictures of the macular degeneration. A drusen and a mild pigmentary changes you can see in the first picture. This is an early stage. The second picture you can see little moderate level of retinal changes. So here the patient may be able to see. Here with more difficulty. In the third level, entire retinal pigment cells got affected and macula affected. There are other geographic atrophic changes also taking place. This one is a case of high myopic macular degeneration. These first two, it is not a myopic macular degeneration. This is even high myopia also. High myopia, it is a very big reason for the macular degeneration. Those kind of cases leads to macular degeneration as well as detachment. This is not a high myopic, but here also the macular degeneration is there. Even this is an exudative macular degeneration. Here, exudation, some edema is there. Wet AMD, much less common than dry AMD. We can't say like this nowadays. This is also common because of the present lifestyle associated with the more rapid progression to advanced sight loss. Wet AMD, neovascularization will be there, edema will be there, central vision loss taking place, and the central macular hole, the unattended things, it is going to become central macular hole also. Once it become hole, there won't be any regaining chances. So the early stages, in the edema stages, treat it and cure it. So then it won't increase to the next level. There will be neovascularization, bleeding, leakage of fluids, scar tissue formation, everything will be there. And it is progression, it is rapid and severe. Even with injections also, its life it is less. These two pictures, you can see the degenerated photoreceptors. This is the degenerated photoreceptors. This is non-degenerated photoreceptors. So degeneration happen means it is very difficult to regenerate it. So this is happening and the fovea becoming thinning. Here the wet MD, it is not degenerated first, but it is unattended going to degenerate. There are new blood vessels developing, edema developing, central vision losing happening. Ayurvedic point of view, causative factors for ARMD according to Ayurveda are the pathological increase of Vata and Pitta. The increased Vata caused compromised nutrition and excretion that leading to deposition of ama at the macula, leading to Sodhorodha, leading to a compromised nutrition in that area, the vision loss happening. The results in impaired function of Alojopita and which is responsible for the vision. The impaired nutrition, subsequent obstruction of the srotas, and the increase of the deranged pittas results in the hypoxia to the macula and thereby leading to choroidal neovascularization. Neovascularization was due to Kumargagamana of the Raktavaha srotas, which was caused by the increased pitta due to the Asraya-Asraya vibhava between vitreous hemorrhages was due to further increase of Vata, resulting in vitreous hemorrhages. Film പോയത് slide. And the special investigations like a visual acuity test, arm's length examination, fundus fluorescent angiography, optic coherent tomography, etc. can be done to diagnose the problem. Next comes the treatment principles of ARMD, that is non-exudative ARMD, predominantly Vata dosha in manifestation. Dravyas predominantly Snigdha and Chachushya can be given. Sodhana required, Sodhana, then Sodhana, Amabhajana, then Sodhana only. Without Amabhajana, Snehana should not given. Snehana, then Virajana, Bastis like Astavana Basti, Anivasana Basti, Brahmana Nasya, and Mustadi Avana Basti can be given. Kriyagalpas like Segam, Ashtodanam with Jivandyadikradam, Tarpanam, Podavagam with Jivaniya Podavagas, Anjanas like Chachu Prasad Anjanas and Garuda Anjana, Jadi Mugala Anjana can be given. The other in non-exudative stages we can do Chirodhara, Chirobasti kind of treatment. Pathyas like Gridavana, Rushna, Leku, Chachushya Aharas can be practiced. In exudative ARMD, the Tridosha manifestation will be there and the Drivya should be Chachushya, Tiktarasa, Pradhana and Kaha, Pitta, Raktahara Ushadas. Need to select. Sodhana required and with Amabhajana, Snehana, Virajana, Masha or Pradimasha Nasya can be given. Thiagalpas like Saga, the Triphalayistic Kashayam, Ashtodhan with the Durva Kridam or Vedalaga with the Mukadi Vedalagam, Anjana with the Netranjanam, Tarpana. It is optional. The first stage we can't do Tarpana here. Podapaga also not applicable. Here the exudative ARMD. So the exudation should come down. Shamana Aushadas will work out. Chakshushya Aushadas will work out. So don't do Tarpana in the primary stage. But the Tarpana it is optional. That depends the condition. If that subsides, if in a possible condition comes, we can do Tarpana. Other treatments like Takradhara, Mustam, like HT Kashayam, Pashagulu Chadi Kashayam. These are all Srodha Shuddhigaram and that is Shodho Haram and Shiroveshna with Shirodhara, Shodhohara Aushadas. Talam can be given. Kapha, Pitta, Hara, Ahara, Viharas should follow. Next comes computer vision syndrome. A group of eye and vision related problems that results from the prolonged usage of computers, tablets, e-readers, and cell phones, which cause increased stress to the near vision in particular. And this is COVID pandemic situation. Children's exposed too much to the computer. IT professional most adopted to computers and mobiles using for the game playing. Relevance. Technological advancement made visual display units an integral part of our day-to-day life. Now, near work exceeds normal ability of visual apparatus by the use of self-illuminating personal computers, mobile phone, etc. Awareness about the health-related issues by a computer is minimum, even in highly educated people also. They know this is not good, but they are forced to do many of the things. According to National Institute of Occupational Safety and Health, computer vision syndrome affects 90% of the people who spend 4 hours or more a day at computers for prolonged periods. A computer using population in India is more than 40 million and 80% of them have discomfort due to CVS. 90% of the school-age children have access at home or school. COVID-19 pandemic in children affects more. Many children comes here with vision problems. The schools reopen, they can't see on the blackboard. Earlier, they were very clearly seen. So this is something very recently happened. So this kind of problems, if we early management is good and proper moisturization giving to the eyes also good in the management of computer vision syndrome. Globally, 98 million children use a computer in home or school for at least 4 hours per day. Causes: poor lighting, sitting, poor lighting in the room, and excess light emerging from the computer, glare on the digital screen, uncorrected visual problems. So that means with the glass only one can see, but they were not using glasses in that condition. Eyes are affecting. So minor strain coming on the eyes also leads to a major thing in the future. So care is better than treating an advanced stage. So poor seating posture, that also a reason. So some people keep the system little down position or little up position for reading purpose. That is not good to keep it parallelly. That gives less strain, and the combination of these factors, because many things, the position and rays emerging from the system, poor lighting, poor condition of the system, everything would be the reason for the CVS. Factors contributing to CVS: refractive errors, abnormal binocular interaction. That means seeing only through one eye, other eye it is not utilizing. Accommodation abnormality. Many people, as I told you earlier, many of the people, if the one is affected with the RP or some other issues, may not be able to focus very clearly to the scene. So they are trying to focus it through one eye. Dryness happening with the continuous usages of system, suboptimal properties of the digital device, other risk factors. And CVS symptoms includes eye strain, dryness of the eyes, eye ache, blurred vision or for distance, intermediate distance or near, and difficulty or slowness in refocusing from one distance to the another, and irritation. Symptoms include blurring in the eyes, headache, pain in the neck or shoulders, tired eyes, sensitivity to light, bright light, eye discomfort. So it is not just the eye problem, and many are getting cervical issues and stress and mouth dryness, many things. Treatment and aim of the aim and manage treatment aim and management to reduce the eye strain, to reduce the photosensitivity, to reduce the eye strain, make the eye moistured, keep a little water near to the system, and that you just apply on the eyes, or apply some pure cow ghee externally over the eyes, that gives some good lubrication. Even the air under the good pure purified castor oil externally application over the eyes, it is a good thing to maintain the strain in the eyes. And the application of netramudam or the drops like alum water is good in the management of dryness. To reduce the photosensitivity, keep some anti-glare glasses. And to improve the ear health, you can do some nasyam with even tiladailam. Nasyam is good. 2 or 3 of drops of tiladailam one can instill in both nostrils. Inhale it well, and from coming, spit it out. Otherwise, leave it. And gargling, kabalam gandusham, it is tiladailam gargling is good. Almond oil gargling, it is good. And other symptomatic management like lubricant eye drops and eye exercises plays a good role in the management of computer vision syndrome. Eye exercises, punctum massages, and sunning exercises, and netra chalanam, netra dhara, kind of all the management they can adopt here in the management of CVS. Prevention is better in this condition. Nasyam with anugayla, segam with goat's milk or cow milk unboiled can be used. That is pure, filtered. Netradhara with Trifila Kashayam, Astodanam with Durvakridam, Puranakridam can be used. Tarpanam with the Jivandyadikridam in an advanced condition. And the dryness always in this CVS, it is similar to that of dry eye. That dryness, even with many other autoimmune reasons also, it may happen. So find out the reason. Why the strain more? Why others are not getting? Why am I getting? So there may probably some reasons also may be there. To trace out the reason, treat for that particular condition. Even sarcoid positive, their eyes are dry. Stephen Jones syndrome, the medicine and reaction, the eyes may become dry. Kritavanas is good. Daily use of homemade kajal, it is good in the management of dryness. Application of castor oil, that I already told you, Shiropyangam, Sirasnanam, daily. Prevention, like palming of the eyes, twice or thrice daily, washing eyes, keeping cold water or tiladila in mouth as a cover for 10 minutes after every meal, or at least once in a day, taking Trifala daily with honey and ghee, practicing Tradala Chikitsa, punctum massages, applying oil to the legs, navel, and palms. Here comes lifestyle modification is the best thing need. Should start right from the beginning and wake up early, do the dinacharyas, follow the good diet regimens. Here with concluding my presentation, Sarvendriyanam Nayanam Pradhanam. Thank you.
Thank you very much. Nambudri ji, very thankful, grateful our students for your knowledgeable lectures. My English is very weak.
No, sir. Very happy, sir. Thank you, sir. Thank you very much.
आपके द्वारा हमको बहुत ही नया ज्ञान मिला, गुरुओं को भी और छात्रों को भी। छात्र बहुत मंत्रमुग्ध हैं आपके व्याख्यान को सुन करके।
Thank you, sir.
Excuse me, sir.
Yes.
Sir, actually, what is Netradhara? How is it done?
Netradhara, it is a procedure, just eye washing procedure. Make the decoction. Even Triphala means Triphala with the Triphala Kashayam. Doing eye wash with the Triphala Kashayam, it is Triphala Netradhara.
Okay, just eye washing with some kashayam.
That is washing continuously for 2 or 3 times.
Okay. Sir, in glaucoma, you said Jaloka Avacharanam. So what is the exact site of the Jaloka?
That is temporal side. So we should tie a knot around the neck and just fix your hands on that knot. Then do some trick here. From that,
sir,
come out.
Sir, I am just out of curiosity. So in temporal side, if you apply, then I think there is a chance of excessive bleeding. Did you have any experience about this Jalokacharanam in temporal side?
Jalokacharanam with excessive bleeding, even it is rectamotionum, it is chances are there, but Jalokacharanam, there is no risk factor at all. If those who are taking some blood thinner medications, there will be some risk factors. Otherwise, there is no risk factor. Even if it is little blood comes also, there are some Shida Ushada Prayogas, and even the Lachajurnam is available. And Lachajurnam with the Durvakradam we can apply in that area. That heals, that helps to control the bleeding.
Okay, thank you so much.
Good afternoon, everyone. It is an honor for me to have an opportunity to propose a vote of thanks on the 97th webinar of Gyan Ganga Knowledge of Voyage. On behalf of organizing committee, I want to express my gratitude to our respected speaker, Dr. Narayan sir, for his knowledge explanation on the topic eye disorder and its Ayurvedic management. Thank you so much, sir, for enlightening us with your detailed discussion on this topic. I would like to thank whole team, wholehearted respected Padma Bhushan Vaideshri Devendra Jaguna Sarji, President Governing Body RAV, for his blessing and continued encouragement. I express my humble thanks to Vaidya Manoj Nesri sir, Advisor Ayurveda, Ministry of Ayush, for providing us his immense support and guidance. We are highly obliged to you, sir. I extend my heartfelt gratitude to Dr. Anupam Srivastava sir, Director RAV, for his constant guidance and motivation. I thank him for his valuable contribution and encouragement. Almost organizing team of RAV and the volunteers who work behind the scene of their tremendous effort to make this webinar series a great success. I am also thankful to all the respected Gurujanas and participants who are connecting with us continuously throughout the series in spite of their busy schedule. Topic and the speaker for the next webinar will be shared with you very soon. Thank you all. Have a nice day. Thank you.
Thank you.